point. We're streaming it live on Facebook, so, and the video will be available to watch later if you'd like to as well.
So if you're not supposed to be here, or if you're supposed to be somebody else, that, oh, yeah, John. All right.
All right.
We good to go, ma'am?
We are. We're running live, so whenever you guys are ready.
Okay. All right. Well, thank you, everybody, for being here, and welcome to the Herald-Tribune's community room. I'm Tom Tryon, the opinion editor of the Herald-Tribune. And a couple of housekeeping things before we get going. Cell phones on no ring. Feel free to tweet and whatever else, kind of social media, but probably rings would not be good. I'm in charge of the bathroom patrol. The bathrooms are behind that door where Mike Lang is pointing. You don't have to raise your hand and get a pass. The door sometimes does shut a little loudly, so you might want to catch it at that point. So, as you all know, I hope, the title for this evening's forum is Medicaid in Florida. How is Florida's managed care working for children, or maybe not working? So before there were a couple still other things. Our conversations in this forum and all our forums are on the record. So if you say something, you may well appear, your quotes may appear in the newspaper. We have Barbara Peter Smith is going to report on this. Since the panelist bios are printed on the sheets, we'll skip the lengthy introductions, even though we have august panelists. Maggie and I will briefly set the stage. Joan Alker will give a short presentation, then we'll have some conversations with the panelists. And we've allotted at least 20 minutes for questions from the audience. And we will be done on time at 7 o'clock, so for those who need to get somewhere else. So to my left is Joan Alker from this takes a minute, I have to look, the Center for Children and Families at Georgetown University, correct?
Yes.
I'm right. And on my right is my colleague Maggie Clark, who has reported extensively on Medicaid and other healthcare issues. Back in January, she did the series 2 Million Kids, $24 billion Battle. And she actually is, let's see, finally, to my far right is the former Sergeant Major of the U.S. Marines, John Annis, also former HT employee. He is the Senior Vice President of Community Investment for the Community Foundation of Sarasota County. So welcome, everybody. So Maggie, your first major project on Medicaid for children in Florida was published back in January. Just give us a few bullet points on what that series was about.
Sure. So managed care. And I started looking around and found that there wasn't a whole lot of information about it. The stories really, there just wasn't a whole lot. And also got the opportunity to do the fellowship, and they really encouraged us to reach out, to parents and really find out exactly what's going on. What do these big systems mean in people's lives? So that was really the focus of the first story, was to look at kind of every different viewpoints of the system. So the first stage story, which we have out in the lobby, I think you guys have it, is from the perspective of a parent and a family. Anya Staten, who you'll hear from later, she's here tonight, detailed kind of her struggle to get care for her son through a very complicated system. And the second day was really the kind of more emotional perspective, what a complex system does to a parent's ability to advocate that they, what rights they have, do they know what those rights are, And then the third day was the perspective of the pediatricians and the physicians. And we were able to spend a lot of time at the Sarasota Children's Clinic with Dr. Herald-Tribune and Lisa Bernard, who you'll hear from later. You know, really see it from their perspective, because that the pediatrician office is really kind of where the rubber meets the road as far as, you know, where the policies come into play with real people. And so we were able in the January series really to kind of look at the whole system and go deep on a couple of issues.
Okay, and so going in, or coming out,
Okay,
actually,
sure.
what was just one thing that you just blew you away? You go, oh my God, I didn't realize that.
The scale of the program consistently surprised me. And we're talking about roughly half of the children in Florida. You know, the number is the mid to upper 40% of, depending on what year you look at. So it's millions and millions and millions of kids. They all have parents, they all have siblings, you know, people who are dealing with the system every day, and you don't hear about it. And I was just stunned consistently at the scope of the program, how much money it is, how many people it is, and I mean, this is life and death.
Right. So, and we'll go back to a lot of this. So let's skip ahead. This past Sunday, you reported on the latest phase of your project, and it involved a survey, right?
Yes. So one of the things that kind of came out of my reporting last fall was you know, learning about the research of the Georgetown Center for Children and Families, who's been looking at Florida Medicaid for about a decade, and you know, was in kind of the research world at the early stages as Florida was getting into managed care. And so Joan and I had talked a lot, you know, kind of as a, you know, official source kind of relationship. And as I was doing the research, I found that there wasn't a lot of information about what was happening in the pediatric practices. Like, well, you know, what were the pediatricians saying? And, you know, after talking with Dr. Fleener and a bunch of other pediatricians, it seemed like that was a big area that was missing from the conversation. And so I reached out to Joan and I said, would you guys be interested in looking at this? And so through conversations, kind of came up with an idea to do a survey. They had done a survey previously. And so we decided to get together and find out what was happening in the offices.
Right. So as part of this very unique project, the survey was funded by
donors of the Community Foundation of Sarasota County. I was going to pause a little longer just for the dramatic effect. But yeah.
So John, tell us why. Why does donors decided to do this?
You know, I don't think I talked to a donor who wasn't interested in more. I think we knew it would be good journalism, but maybe with a bad story. That's some of the ways I talked to donors about this, is that we really needed to hear from pediatricians and others and families beyond just what we knew from our local work, the challenges that families have navigating the system. So the work we do with the Patterson Foundation and others in the campaign for grade level reading, this is right in that sweet spot on what we need to know and what the challenges that families face. Our two-generation work, what families are dealing with, all the things Maggie just said, were a perfect fit with the work we're doing, some of the work we're doing at the foundation. So it was not a hard sell to donors. I don't think I talked to a donor who said no.
Okay, so for the few in the room who may not understand or not be familiar with the two-generation approach, for example, give us just a synopsis.
So the two-generation approach says if we want families to be successful and we want this to be sustainable success, we have to focus on a few things. Economic supports, and healthcare I think falls in that area, but economic support so a family can pay their bills and make sure their kids are healthy, and then we provide educational opportunity to the children and the parents so that they can be successful, and then kind of this social capital piece is how do these families connect with other families that want to be successful or others who are successful. We all have social capital. We're here together today. We probably have someone we could call if we're struggling through the system. Many of the families we work with don't, or that our nonprofit partners work with. So the two-gen approach is working with vulnerable children and their parents together, and this program fits, again, perfectly right into that spot.
Okay, and so I'll try not to steal the punchline, but on the grade level, the campaign for grade level reading, which the goal is to have all third graders reading at grade level by the time they're in third grade. But tell me some of the things that you and others who've worked on this campaign have found in terms of it's not just a third grade issue.
right?
What kind of things go into that?
So that is when the test happens. So that's when we're gonna get the results on how we have done as a community on getting kids ready to read by 3rd grade. This isn't a teacher thing, this is a community thing. Part of that is, so Campaign for Grade Level Reading is school readiness. Think about how health fits into school readiness. Absenteeism, think about how health ties into absenteeism. And then this summer learning loss. Maybe some of that is health related, but still summer learning loss. And then a big chunk of this is health and well-being. Are the families healthy enough so that they can really focus on literacy and education? And when Maggie talked about half of the families, in some of our Title I schools, you think of Alta Vista and Tuttle and Goshio and Emma Booker, over 90% of the kids in those schools are on free and reduced lunch. Those are the families that are gonna be right here trying to navigate this complicated system. So this report, all the reporting has been fantastic. The idea of doing the survey statewide and getting more information, you know, Joan's work, we've read Joan's work from before we knew Joan. So, I mean, that kind of work, we needed to understand how it was applying here in Sarasota and in our Fort County area.
Right, so that essentially helped tie everything together. We had, if you expect children to read at 3rd grade, they need to be healthy, they need to be in class, and all those things relate to their access.
Oh, this goes right back to prenatal depression and things like that, right? We gotta go way, way back, and what can Medicaid cover, and how do we, many people want families to be successful. What's the process to help them be successful, right? We wanna go to the end, we want kids to read in the 3rd grade, but we don't wanna do all the things that are gonna lead to getting them reading in the 3rd grade, and then we wanna hold our school system accountable for things that should have happened before the kids even got to school, and things that are happening to them when they're in school. Teachers nowadays, what are teachers responsible for? What are they not responsible for? And health is a big part of that.
Right. Okay, terrific. So I hope that gives everybody a general picture of why it was funded, and some of the benefits we hope that will come out of this research eventually. So I mentioned that the Herald-Tribune had 2 major partners in this, and the other is, of course, Joan Lace. So we're going to turn it over to her for a few minutes. She's got a slideshow.
Yeah.
Oh,
Great. How do you know? Should I go over there? Is it this PowerPoint right here?
Yes.
Yes. Yeah. Now, is that bad though if I'm over there clicking?
No, you don't, I can just, do you want me to just run it?
Sure.
Yeah, just
That
run it.
sounds great. Okay. Well, first of all, I want to thank you for both inviting me to be here and also for supporting this project. I will say at the outset, we've never done a project like this before. When I was approached by Maggie, who is wonderful, I was excited, but I was a teeny tiny bit nervous, to be honest. We are a research institute, and we feel pretty strongly about maintaining our independence. And we work with a lot of journalists, and most of them are fantastic, and I knew Maggie was. That's what gave me confidence. But I wanted to feel comfortable that we would really have ownership over the findings, and that, this would not be anything that was sensationalized or, So all to say that it's just been a wonderful project, and I really have to say, coming into your community and meeting John and Deb and others here, you are really lucky to live in a community that has this level of engagement and support for this kind of work. It's very special. I really haven't seen that in many places. And I think so much of what John said is so true, that we have to understand the connections. We have to understand the connections with parents. We have to understand a lot of your parents are uninsured here in the state of Florida because the state has refused to do the Medicaid expansion, and that's a very serious problem for kids as well. And we have to understand the connections between all of the ways that we want to intervene to make kids' lives better, and those connections between health and education, and more and more of the research keeps backing it up to 0 to 5 and the brain development, but also, when you think of high school graduation rates, you don't necessarily think about, well, if they have chronic asthma when they're little and it's not treated and they miss school, that can be very predictive of, are they going to graduate from high school? So these issues are really, really important. And just one more thing, I'm going to just say some positive news before we get to some of the findings, which are a little discouraging. I've worked on Medicaid for a long time now, over 20 years, and the Medicaid program is, it has its challenges, but it has made an enormous difference for children in our country. We'll talk about the uninsured rate, it's brought that down, but also when you look at national studies, you see that access to care really is very, very much better for kids on Medicaid than when they're uninsured. Even though we're going to talk about access problems today, there's no question that kids are much better off in Medicaid than they would be if they were uninsured. And even compared to privately insured kids for access to primary care in particular, they kind of look the same in the national surveys. So we face challenges in Medicaid, but it's important to remember that its value as a program is enormous. And I think the children's piece tends to get overlooked, even though they are half the beneficiaries of the program. They're not where a lot of the money is, and they're not really where a lot of the attention is. So that's another reason I think this has been a wonderful project, because Medicaid is a kids program, but folks don't think about it that way. So with that, let's go to the slide. So this is just a little bit of background information. Maggie alluded to this. Medicaid covers an enormous amount of children. It is about 42% of kids in Florida. Did folks here know that? I know some of you are experts, but it's
42%.
pretty shocking. And if you looked at kids 0 to 5, it would probably be up closer to 50%. So this is an incredibly important, you're just not going to, apart from the public education system, you're just not going to see another system that is touching so many kids' lives. And that's why it's so important that we understand Medicaid is a kids program. So here in Florida, we're not going to talk much today about Medicaid providing insurance, but we're going to talk about how the care is delivered, and that is through the managed care system. As of this move to managed care, which started way back with Governor Bush, I mean, you had managed care before that, but a concerted effort to move the whole program into managed care, you now have 95% of your kids in managed care. So that's the delivery system. That's what we have to think about if we want to move the dial on getting to better outcomes for kids. And just very quickly, what does that mean, managed care? It means that the insurers are receiving a monthly, we call it a capitated amount, a monthly fee, and then they're at risk to provide the services for kids. So that changes the financial incentives from when you have a fee-for-service reimbursement system. And most states are in managed care, not all states, but Florida's in it in a really big way. Next slide. So this is just, again, just to provide some context that we have made huge progress in the U.S. Thanks to Medicaid and the Children's Health Insurance Program. The uninsured rate is at a historic low of 6%, but unfortunately Florida lags behind on this. This is from another study we did. Your rate is 9.3%, so you rank 46th in the country. So it often surprises people to hear that Florida has the highest uninsured rate for kids in the South. So you have some neighbors like Alabama, Louisiana. You may not have thought of Alabama as a high performer. Their uninsured rate is below 4% now. They have made a huge effort and doing very well. So it can be done. It can be done in the South, and Florida has really fallen behind. Next slide. So I'm not going to spend a long time on this, and we actually have a whole other report on this, but there are what we call the child core set. These are quality measures that look at things like access to primary care physicians, access to immunizations, a lot of different indicators that all states can report. They don't have to. Florida actually gets kind of a gold star for reporting a lot of these measures, even though it's voluntary. But unfortunately, they're not performing very well. They tend to perform in the lower half of states. And here we've got a couple of them. Access to primary care, an actual primary care visit is very low. You can see it's 80% there for kids 7 to 11. In the past 2 years, it's 91% the average for reporting states. So some of the measures, Florida is a little better. Some of them, they're absolutely at the bottom, like dental care, which I know Maggie's gonna get into that issue. So Florida does deserve a gold star for reporting some of these, but unfortunately the performance is low, and we've got a whole another report on that if you're interested. So let's move on. So we're going to talk primarily today about our survey that we conducted with the help of the Florida chapter of the American Academy of Pediatrics. So we surveyed pediatricians, their membership essentially in the state. We had 131 pediatricians respond to the survey. That was about 6%, so that wasn't a great response rate. But what we found is that those that did respond had a lot of experience seeing kids on Medicaid. Here you can see in this pie chart that 61% of those responding said 50 to 100% of their practice was Medicaid kids. So they are seeing thousands and thousands of Medicaid kids. So we feel really good about how we need to take this seriously, right? Their opinions really represent a lot of day-to-day experience seeing kids on Medicaid. So while we wouldn't say you can say every finding is generalizable to the whole state, I think these are some findings we need to take seriously. So we did hear from pediatricians all over the state. We had a handful in Tampa, St. Pete, and Gainesville. Those were our biggest, but those were only 5 or 6. Really, we had from all kinds of zip codes around the state responding. Here on the next slide. So first issue I wanted to raise is that we did hear evidence, and this actually was something I heard about before in my previous work here in Florida, of what we call churning. Okay, this is a problem in Medicaid, which is you sign up, but then you get dropped off, or in the case of this move to managed care, what we've heard a lot about is that you get dropped out of the plan you were in, or you had a primary care doctor, but then your doctor got switched or your plan got switched, and the family is unaware of this. So this was an issue we flagged, and we did hear from 69% of the reporting physicians that they've noticed an increase in this particular problem since managed care came all the way across the state for primary care. So I think you're going to hear more about this, but this, needless to say, it's a sign that the state is not doing a good enough job of doing outreach to these families, explaining to them the enrollment process. The auto-assignment process is kicking in, and families are being defaulted into plans that may not be the best choice for them. Next slide. So now we're going to talk a little bit about access to care issues. So again, I just want to remind folks that when you look at national data, particularly with respect to Medicaid kids versus uninsured kids, they are doing much, much better than uninsured kids. But nonetheless, there are challenges. We asked in particular, when you bring managed care in, there's always going to be a clash to some degree between the plans and the doctors, right? I mean, the managed care plans are brought in to manage the system. But what we asked here was, have you had cases where the plan, either because of benefit limits, which you really aren't supposed to have in Medicaid for kids, but that's another story, or prior authorization? Essentially, think of it as red tape, where a physician is identifying a service or a treatment that they believe is medically necessary for that child, but they're not able to get it, or they have to keep going back at the plan and keep spending hours and hours trying to get that service for their kid, and they're very frustrated. So we did hear that was a problem in many cases for 55% of the respondents, and in some cases for 27%. So that is really the vast majority of respondents. One area just to flag for folks is that we heard a lot of concerns about accessing medication, both prescriptions and over-the-counter meds. For kids. That was 84% of physicians said that that was a problem. And there were a range of different kinds of problems they identified, but that was something that kept coming up over and over again. You can go to the next slide. Access to specialists. So this is something you hear quite a bit about Medicaid in general, which is, the access to primary care looks pretty good when you look at these national surveys, but there are clearly areas where access to specialty care can be a real problem for these kids. And if I would say one thing that really jumped out from the findings was that when we asked pediatricians who make referrals, what's the most difficult kind of specialist for you to find? It was behavioral health, mental health professionals. That came through loud and clear. And we've heard that anecdotally in a lot of places, but it was certainly confirmed by this work. And I think this is an area that is really worth some more thought. We do know that kids on Medicaid have high rates of mental behavioral health issues, so something we should talk about more. Other specialists that were noted as difficult: dermatology, dental, definitely a problem, orthopedics, and then less difficult specialists to find: cardiologists and pulmonologists. Folks said they didn't have so much trouble with. So we can move on. So this is just kind of a concluding quote that I thought was really interesting. We asked pediatricians about some of their general perceptions, and I'm going to read this to you. Medicaid managed care has only shifted responsibility for regulating a difficult system from the government to private payers. This has led to increased fragmentation of the Medicaid population, and it has made care coordination more difficult than was previously the case. The red tape and oversight that physicians are subject to in dealing with Medicaid managed care patients is daunting. So what really jumped out at me was the middle part of this quote, because the idea behind managed care, which in theory is a good thing, right? I mean, it's a good thing to manage care and make sure that patients are not subject to a myriad of procedures and providers. You want their care to be managed, but obviously you want it to be managed well. You don't want the companies just going in there to try to save money at the patient's expense. And here that the physician was saying that it's made care coordination more difficult, I found really fascinating, because that is the whole essence of managed care, is to make care coordination easier. So I thought that was super interesting. So with that, I will conclude. If we go to the next slide, you can just see some concluding thoughts here. The pediatricians were very frustrated, by and large, with barriers to care, low reimbursement rates, an obvious problem, delayed payments, and administrative burdens, kind of haggling with the system. That was taking a lot of their time. They generally believe, some felt differently, but the majority thought that managed care had made the system worse for their patients. And then, as I mentioned, the national quality indicator suggests that Florida has a lot of room for improvement. Thank you.
Great, thank you. Maggie, any surprises? Did anything surprise you from the survey?
I was surprised to hear about the issues of access to prescriptions, although I probably shouldn't have been. It's just, you know, it's one of those things that's like, well, if you're sick, you need medicine. And, you know, that so many, it was up in the 80s or something?
84%.
Yeah, 84% of the pediatricians said access to prescriptions was a big problem. And that seems, that's really high.
I think Dr. Friedel
Yeah.
will tell us.
Yes,
will
I'm
inform
sure
us
she will.
about,
And that's why I say I don't know if I should be surprised, but
although we might have to sedate her first. So, you know, Joan, as you're looking at this from your perspective, not just as a surveyor, but as a policy person, one or two things, I mean, we've got people in this room who can have influence over public policy. Any one or two recommendations that you're thinking at this point, albeit early?
Right. So I think, you know, again, managed care is not inherently bad, but for managed care to work, and I will tell you that from a national perspective, Florida's managed care doesn't have a great reputation, and it hasn't for a long time. This is nothing new. I remember the Sun Sentinel in the 90s did a big series on major problems with your managed care. And so what I think is so critical is, because this is the delivery system for so many of your children here in Florida, that you need to really hold the state's feet to the fire, right? We need some accountability here. In my opinion, the state is too close to the plans. And part of the mindset behind moving to managed care was, in some respects, to outsource the management of the program. That was sort of talked about in that quote we just talked about. And that's problematic. You know, we need to make sure that there's accountability for the taxpayer dollars that are being spent and the services that children need. And that's where we're going to have better data, quality indicators that you can track year to year to keep track of these things, better information for families so they're aware of their rights. Because frankly, on paper, Medicaid provides a very strong benefit for kids. It is supposed to provide all medically necessary services at no cost. That's not what always happens in the real world. But everybody needs to get more informed about what Medicaid's supposed to be doing and shine a light so that there is accountability in the system.
States, is there a particular state that does managed care well, and what might be the difference between that state's managed care system and Florida?
So there are some states that I think have a pretty good reputation. A very small state I'll mention is Rhode Island, which has it only has a couple of plans, but they're very highly ranked. And they were plans, the one that's the highest ranked, that came out of community-based health centers. It's not a for-profit plan. Typically, the for-profit plans have worse ratings than the nonprofit plans, although we don't have great data on this. There's a lot we don't know about Medicaid managed care. But systems that are really based in the community-based providers tend to work better.
Okay. Mr. Annis, you're an idea man. Thoughts? I mean, what are your takeaway points from this?
We'll hear more from the parents, I'm sure, but the part of what I was hearing is how frustrated we all are with the system. Imagine if you're that single mom with 4 kids and you're trying to get the bus transportation lined up and get your child out of school and not miss any work at the same time. So our frustration, how many times does that have to be magnified for a family that's really trying to make it, and every obstacle possible keeps being placed in their way? That's part of what I heard from this. And as far, again, as how well we are doing with some things, it was great to hear that, is that we're reporting how badly we're doing this. Right? It's somewhat exciting to me, I guess, in a strange way. I heard someone else refer to it as mismanaged care. So a little bit more frustration for me. I'm not totally surprised, because I think this is what we expected, but it was good to see it in writing and being reported in such an objective way.
And you mentioned attendance, one of the drivers on the grade level reading, right? We're finding that across the board. So one last question, Joan. If Florida if it spent more, do you think that we would get perhaps better managed care companies, and B, is there a correlation between spending and quality?
Well, is it a big picture matter? No, in the sense that the U.S. spends far more in its healthcare system and we have low quality compared to other countries. However, I think with respect to Medicaid, yes, Florida is a low spender on a per capita basis as compared to many other states. Florida, your legislature has not really wanted to invest in the program, and I think that is reflected in your outcomes.
And in Medicaid, who sets the rates, the reimbursement rates?
The state sets the rates, although the federal government has to do oversight to make sure that they're what's called actuarially sound, that the capitation rate actually can meet the needs of the patients. Now, there are some new regulations out from the federal government about Medicaid managed care. They're very important regulations. They've just been issued, and it's been 15 years since they've been updated. And they are trying to beef up this notion of having your capitation rate work. So who knows if that will help, but hopefully we'll see a little more oversight on that too.
All right, and I think Maggie, last thing for you, in your one of your stories, you drew the distinction between reimbursement rates for Medicare, which are set by the federal government, and Medicaid in Florida. You got this on the top of your head? Sorry.
It's about half, and that tracks basically no matter what type of visit that you do. So, for just a basic visit, for seeing a child on Medicaid, a physician's going to get half of what they would get if they saw a similarly ill senior covered by Medicare. And that's a result of, Florida sets the reimbursement rates for Medicaid, the federal government sets the reimbursement rates for Medicare.
Okay, and just, I guess, one final question, and we hear it a lot. Legislators say, Medicaid spending is out of control and it's taking up this huge part of our budget. How do you respond to that when you hear that?
Yeah, I have a lot of responses to that, but I'll try to be pithy. So first of all, Medicaid, if you look at its growth rate on a per person basis, is very low. It's lower than other healthcare spending, right? Healthcare spending keeps going up. But Medicaid is a very lean payer, especially here in Florida and especially for children. They are the cheapest group in Medicaid. And one thing I wanted to mention, we did another paper last summer that looked at, there's a lot of really interesting new research coming out because Medicaid has just had its 50th birthday last year. And there are a lot of kids in the 80s we phased in Medicaid expansion. And so there's been a lot of research done looking at kids that had it versus kids that didn't. And this research is showing long-term benefit, like higher high school graduation rates, better economic outcomes, and hence a good return on government investment from taking this long-term view. That's not what legislators tend to do, but as we start to think about the whole family and the whole child, I think we really need to make those connections and understand that this is good investment. And the federal government is paying a majority of the money, so the state is getting a very good return on that dollar when they put up a Medicaid matching dollar. They're pulling down federal money. And last thing I'm gonna say, because it happens all the time here, and reporters, please check this. Whenever they say Florida, that Medicaid is 25% of our budget, they usually are including the federal share. It's just not right. And so you need to fact check that whenever they say it.
Okay, terrific.
Yeah.
Mr. Annis, thank you very much. Joan, thank you. And we're going to do a little switcheroo here. So while they depart, we're going to bring up Dr. Corolla Fleener and Anya Staton. I practiced that several times. Yeah, so, well, thank you both for being with us today. So we'll start with the good doctor. Are the results of the survey consistent with your experience?
Absolutely. Absolutely. I was so impressed with the fact that Medicaid actually gives the government a good return on its investment. And I was also very impressed with the proof that Medicaid eligibility is resulting in better education, better financial situation. And even I read the study that Joan Holker had done, better health as an adult. Lesser blood pressure problems, less hospitalizations as adults. So what we're doing when we provide medical care to Medicaid patients is extremely important. That got hammered home to me pretty strongly today, and I was really happy with it.
Well, great.
Yeah.
So Anya, as a parent with children in Medicaid, have you been bumped? Have you experienced that feeling of, oh, when you show up at a doctor or something else, no, you're not in the program?
Absolutely. Unfortunately, I don't think there's an element of what either speaker spoke about that didn't resonate in some way with my personal experiences. So I really appreciated what John said in regards to families who are trying to work for success and betterment of themselves and who are really being pulled down by the Medicaid system. And as someone who is a single mother, not of 4 children, but of 6, and also a working single mother, and I attend school full-time as well, it is definitely a struggle to try to work for the betterment of my family and my situation, and still have to take entire 4-hour periods of times, 8-hour periods of times on some days, just haggling with insurance companies to try to get the health care that my children need. That includes entire days of driving around from appointments from anywhere from Fort Myers to Bradenton to St. Pete because of difficulty finding providers who are local to my area. So I can relate to all of these things, unfortunately.
So Maggie, set us up here when
Sure.
you profiled Anya, a little bit about her experience with specialty care, and then we'll ask you to chime in, but just tell the story very quickly.
Sure. So Anya and I connected last fall, and I was totally blown away by her story. Basically, she had exhausted, the whole appeals process. We were talking about, Medicaid on paper is a really, robust system, and you're entitled to every medically necessary service. But her son was ill with an eating disorder, and she found that while the kind of the rules of Medicaid say one thing, the reality was the other. And so when she contacted me, I guess that was like October. So Malik had gone to treatment at that point, but it had been a 10-month struggle. Am I right about that at that point? By the first, from the first, I guess hospitalization at that point. So what fascinated me about her story was the unbelievable effort that she and a team of physicians and social workers at Sarasota Memorial had to go through to get what is care that's outlined, as available. And, every tactic that the insurance company used, every roadblock that was possible. And when you think about this is a system designed to deal with vulnerable children and families, to put up that many barriers, more barriers than I would imagine pretty much anyone else would face to accessing healthcare, that's what you're putting on the people that need the most help.
So your son needed specialized care in what?
We're going back to the issue of Medicaid and behavioral health care. So just to give a brief background of the story, in November of, not this past year, so November of 2014, my son began to show symptoms of anorexia and severe depression and anxiety. And I did quite a bit of research myself and took the information to his doctor and attempted to schedule an appointment for him with his pediatrician. Unfortunately, the pediatrician appointment couldn't be scheduled for more than 30 days out because they were just so busy. They were not able to get me into an appointment, although that was the weekend of Thanksgiving, until after the new year. So that was the first problem, was not even being able to get a basic pediatrician appointment. And so Malik's health severely declined during that first month, to the point where he had lost so much weight, and along with that, so much mental reasoning. He was Baker acted a little bit before Christmas. And unfortunately, again, once they saw that we had Medicaid, he was held for 72 hours under a Baker Act and then just sent right back home. There was no behavioral health care follow-up. There was nothing that was available or offered to him at that time. And so I pretty much had to sit still and wait for his scheduled doctor's appointment with his pediatrician. Once I met with his pediatrician at the beginning of January, again, his health had just severely declined day by day and week by week at that point. And still, looking at my insurance, there was nothing that they could offer me for behavioral care. So by mid-January or so, Malik was admitted to Sarasota Memorial Hospital. He was in severe condition. Dr. Uwe King was one of the wonderful teams of part of the team of doctors at Sarasota Memorial that assisted with his care. And he ended up being there at that time until about April. So his first day was about 3 months. During that entire time, there was no counseling, no psychiatric care, no behavioral health care that could help deal with his issue, which had been finally diagnosed as anorexia nervosa, of which he had a severe case. So he needed to be tube fed in order to get his weight up to a reasonable level. And by a reasonable level with anorexia, that would be 15% of your ideal body weight. So for him, that was still extremely low. He started out at about 108 pounds, and they were trying to release him from the hospital, still in the realm of 70 pounds or so. He obviously was not better at that point. But unfortunately, because the actual issue wasn't being dealt with, and instead he was just being tube fed up to a weight that was considered an acceptable level by his insurance company, the doctors had no choice but to send him home. And so it didn't take long. As a matter of fact, it wasn't even 24 hours before he had an anxiety attack and had to be Baker acted once again. And so we started the whole process over again. And even so, they did at that time set me up for a mentorship group that was really aimed not towards anorexia, not towards behavioral or psychiatric care, but instead towards troubled children. And that really wasn't what he needed. He was dealing with a severe psychiatric illness, and even with that appointment, again, it was scheduled more than 30 days out. So Malik never made it to that appointment before he ended up back in the hospital again. But at this point, he had been seen by his pediatrician multiple times, who had tried her very best to get him admitted into the hospital. Unfortunately, the insurance criteria said that his heart rate was not quite low enough. It was hanging in the 70s, and they wouldn't accept him. This was what his pediatrician said, unless his heart rate dipped into the 60s or so, where it could be officially bradycardia. So he was at an appointment, actually he was at an appointment and he was sent over to the emergency room. From there, at a certain point, she finally got fed up and said, I think he's right at that point where they might accept him. I'm gonna send him over, take him over right now. And he basically went into shock on the table right there as he was admitted. Dr. Uwa King and I had to deal with him basically going into the beginnings of heart failure because he had finally gotten to that rate where insurance would allow him to become inpatient. So that was the beginning of it. And from there, I had found myself a team of advocates at the hospital who had watched my son nearly lose his life. And so I was no longer alone in my battle with Medicaid. Suddenly I had social workers and doctors who were on my side. And so we fought really hard to find him the behavioral health care that he needed, in particular inpatient with the psychiatric care. And that wasn't an easy battle, as Maggie knows. So.
Right, they went through a court proceeding and made the insurance company own up to what they had done. And by the time it got to the court, it was like, oh, yeah, we owe him this service, but why did it, it had been at that point 9 months? I think it was in August, right?
Where he had entered the hospital in January, by the time he was accepted inpatient, it was August. So my son had basically languished in the hospital for all of but 2 or 3 weeks in between there, where he had been kicked out and then put back in for a good 10 months or so before receiving any of that behavioral health care that he needed.
So we'll ask the doctor, so it was as dangerous as she described?
Yeah, I sure think so. I do believe that's true. And I'm seeing these types of things almost on a daily basis. The people least able to navigate this maze and try to obtain what they really deserve, medically speaking. These are just common small things, but trying to get crutches. I can't get crutches, okay? I have tried, but I can't get them, because they give you a list this long of places you can go to, and I've sat there and spent an hour calling all these places. Oh, we don't provide crutches, you know what I mean? Trying to get medications. Just this week I had the most ridiculous situation of one pharmacy telling me we had to do a prior authorization for amoxicillin. And this was at night, and of course you can't talk to customer care, and you can't talk to the pharmacy at the insurance company. And I said to the pharmacist, would you run that through again? Because I'm really having a hard time believing this. And he ran it through and he says, yep, they want a prior authorization. So what alternative do I have but to tell the patient, go pay for your crutches, go pay for your prescription, for your months. I told her, you might as well go across the street to Publix because they're going to sell it to you cheaper. I'm to the point now where I know what all the prices on all the meds are. And it's true, our formularies are extremely restrictive. They're changing them faster than we can keep up with them, and it makes our way of practicing medicine. This managed care system is forcing us physicians to practice medicine in a different manner. I am under contract with a managed care company who says I should take call all night. Well, what good is that if those patients have to go to CVS, and in Sarasota County, we do not have a CVS that is open all night. So at 3 a.m., I'm happy to call that in for you, but you're gonna have to go pay for it. And CVS, by the way, isn't open at this hour, so you ought to go over to Walgreens and pay for it yourself. So these things that Medicaid has offered the people they're not truly being available, okay? We can stand on our heads, but they're not available. And they force us physicians to practice. When I can't get a referral to a specialist, I'm forced to provide that medical service to that patient. And sometimes that's beyond the limits of my training, because I didn't train as a specialist.
Right. And that's what you experienced.
Mother was forced to provide for her child at a physician level, way beyond her rank, so to speak, in her
I've
knowledge
actually
and her
often
training.
said that.
And I'm sure you did the best you could, and unfortunately, we doctors are also in that position, okay? If I could tell you how I feel as a doctor, having to refer to a specialist whom I don't know, that's a real uncomfortable situation because I really care about my patients. And sometimes, for example, in dermatology, it has happened to me in the last 2 years that my staff has cultivated a good rapport and relationship with a dermatologist, and suddenly they're like, nope, we're not doing that anymore. So now we have to find another dermatologist, and we go ahead and we send all our patients, it's like a tunnel. They all go there, okay, they all go there, okay. And suddenly, nope, we're not doing that anymore. Now we're on number 3 in 2 years, okay. But it's even worse when I have to send somebody to a doctor way out of town, up in Tampa, whom I don't know. And then I have to call that doctor and say, why didn't you write me a report? Are you concerned about this patient? I am, you know. And then suddenly the doctor says, well, I just started taking Medicaid, and yeah, I'm pretty concerned about the patient, but I don't know how to hospitalize the patient. And I'm like, oh, great. Why didn't you call the primary care provider, and we could have gotten this happening, you know. But we've been doing this in my practice for many, many years, since 1990 to be exact. And we have been doing Medicaid, and sometimes to the tune of 15,000 Medicaid patients per year. So this is not a hobby. This is my
Separate
practice.
patients.
85% of my practice is Medicaid. And my staff are, Maggie's, you're a witness. They are experts. They know how to get what we need, how to finagle the system, how to navigate the system, but our patients don't know this,
Right.
you know, and we're getting newborns come out of the hospital and they come to the front desk, and what happened? Oh, your Medicaid hasn't been activated. Oh, I'm sorry. Yeah, you got the same insurance company as your mother, but you know what? Assigned to another doctor. Meantime, let's talk reimbursement. My board-certified pediatrician daughter goes into the hospital to see a newborn in the nursery, and the pay is $24.75. I can't get my plumber to my house with a trip charge of $24.75, okay? My plumber wants $59 to get to my house and tell me what's wrong, okay?
So you're saying, so money, in this case, money could beneficially change the system?
Well, it did in 2014 when we had the equivalent rates, and they upped us to the Medicare level of reimbursement.
Right. That was
Suddenly, we were able,
I was going to say, that
No,
was
you say it.
the result of the Affordable Care Act. The federal government inflated Medicaid rates, and they did that across the country. So for 2 years, Medicaid pediatricians were paid Medicare rates.
that was great.
Yeah.
We were able to hire staff. Our staff was able to help the patients. I think our level of care actually improved humongously, you know, but this was like a bait and switch, because after 2 years, boom, they got our pay 60%. Now what? I don't know many people out there working who get their paycheck cut by 50 to 60% and then suddenly keep on doing the job. So I'm still asking myself why we are doing the job, you know.
Why are you?
Yeah, that's a
No,
really,
really, seriously.
Why
Why do you do it?
It is a question that we ask ourselves daily, but it kind of grew like Topsy, and it's what we do. And I think Maggie came in, and at first I think she found that I was very hesitant to open up my practice to somebody involved with the newspaper, and actually I have to thank the Community Foundation for helping everybody shine a light on this, because now I see that we're able to actually talk about this. But I had calls from my peers, from other doctors, who said, we're living what you said. You know, they recognized that the words, and I thought to myself, how can I explain all this to Maggie in 1 week? Or 2 weeks?
It wasn't 1 week.
It
was a long
She basically became one of us and embedded herself in my practice for the longest time. And as she took it upon herself to learn what each staffer did, and how these pieces of the puzzle fit together to provide what is really, I think, a medical home level care, a wraparound care for these patients. And they need more care than the patients from Blue Cross and Cigna and AvMed, because they don't have the educational level to even understand where they have to go, how to make an appointment. We have people who help you make an appointment. You know, it's that bad, you know, but.
So I'm going to ask you each, I'm going to tell you that you can wave your magic wand twice. Ooh. So wave your magic wand twice and say 2 things that you would change if you could change them.
2 things that I would change. Ooh, okay. Well, I have to say that from a community perspective, I agree with Dr. Fleener that I personally find the most frustrating thing that these are the most vulnerable members of society as well. And my family has been on Medicaid for about the past 3 years now due to a really awful family circumstance that left me as a single mother, and coming from a pretty much lifelong financial stability into instant poverty. So I've kind of lived on both sides of the realm. And having done the best that I could, I basically threw myself into more than full-time employment at a local foster home because I really had a heart for women and children who were struggling like I was. And I felt like the best way to maintain my family in the midst of my sort of chaotic circumstance was to give back to others. And so in dealing with the 60 or so foster children that I've dealt with over the past 5 years who have come and gone from our organization, I've seen the exact same things. And while I'm not able to speak about individual cases, I can say that it's not just my 6 children who are struggling with these things. It's a pervasive problem in the community altogether. And so I would just like for the thinking to be changed, that these are not, these are people that have the ability to be successful and to be valuable members of the community and to give back. And just like John said, they're not going to be able to get there if they can't get even basic good health coverage for their kids and health care for their children. So I think my first magic wand would be just to change the thought process of the community for them to realize how important this is. And I am really thankful that we're having this discussion today, and there's definitely something to be said for that. Secondly, I don't know if I can bunch everything else up into one issue. I've had the same exact problems that Dr. Fleener has discussed with authorizations and medication issues and all of those sorts of things. My children have had their insurance companies changed without my knowledge. All of those things have happened personally to me. I think the most frustrating thing was the monetary element of that, so that might be my second magic wand. To put a price on the healthcare or the life of a child is just about as low as society can go, in my opinion. So to think that my firstborn son's life was only just as valuable as his Medicaid card would offer, that was really, really disheartening. And even though he is out and he is in outpatient therapy, I can tell you that it has been a constant struggle to maintain the care that he needs. And although he does now have an eating disorder specialist who counsels him, and he does now have a dietitian, and he has these things, besides the battle to get them, they're constantly being pulled, they're constantly being confused, they're constantly being redirected. I can't tell you how many times I've showed up at a dietitian and they have said they didn't pay the bill. Or I actually had a really bad circumstance with his counselor who had to call me basically and say, I know you're on the way for an appointment, but they haven't paid us ever since he started in November. It's been almost 3 months. We cannot continue to see him without being paid. I realize that there's a certain patient-client criteria rules that I need to follow, so I will see him for free today, just as a courtesy to him, but I won't be able to do anything with him after that point. And so I literally spent the entire week, I think I took off every day that week, trying to juggle classes, called out of work, just yelling at people on the other end of the phone and saying, you know what, we've taken you to court before, it's not my first rodeo, I'll do it again. But unfortunately, that does cause extreme financial harm to me. It causes stress to my family. My kids see what's going on. I can't be a good mother. I can't be a good employee. I certainly can't be a good student. And so I really feel for those in society who don't have any educational level, who some of whom have difficulty even with language skills. I can't imagine being on the phone and having to threaten taking people to court and doing all of these things without at least having some of the skills and resources that I've accumulated over the years. So that is the other thing that really makes me mad. A dollar figure should not be above a child's head. Their health should be of the utmost importance to society.
We gotta get you a big wand.
I
Two
got-
things you would change.
Yes, sir. I think that the MMAs came into existence when the state of Florida transferred Medicaid into the hands of insurance companies. I think that was initially an experiment, and I think it's failed. And my first wish would be undo that.
Okay.
I have no problems with Medicaid. I did Medicaid for 20 years, and if I asked for something at the last minute on Friday afternoon, it was given. I never had an argument, they always paid. That'd be the first thing I would undo. I think we need to get these insurance companies out of the mix.
Okay.
I can't negotiate with them, I can't talk to them, I can't even talk to the pharmacy director. I can't talk to nobody, I'm just nothing, you know? And at least with Medicaid, they did what I wanted, and what I wanted was the best for my patients. And
Alright.
the second wish is, I would like to see the Medicaid up to the Medicare level. I think Florida needs to say, look, the old people and the young people are the same. It's just as complicated to take care of a newborn that comes out of that hospital with a long list of problems as it is to take care of a 60 or 70-year-old person with a bag full of prescriptions. You know, so those are the two things I want to see done, and I don't think either one of them. I'm
All
sorry.
right, well, thank you very much. So, I think we will entertain questions from the floor. I did not go to church this Sunday, so I didn't get my sermon, but if you could just try to get to the question as quickly as you can, that would be nice. And if it's for John or Joan, they can come up and talk into the mic. Yes?
I think it kind of begs the question, but obviously the system is not working for the kids or the families, and it's not working for the pediatricians. So who's it working for, and what
Right,
do they need
okay,
to do?
so I'll repeat the question. It doesn't appear to be working for the pediatricians or many of the parents. Who is it working for? Is it working for anybody?
The insurance companies.
Insurance companies.
Yeah, although if you
Wait,
ask
but-
the insurance companies, they'll say it's not working for us either. Although I think they're getting a better deal than the kids, definitely.
They are the middlemen that are making a profit by limiting medical care to the patients and limiting the supplies and the medications to the patients. It's as simple as that. That's how they make their profit, at the expense of the patients.
But last, Joan, are the profit margins, is this publicly available information either in Florida or in other states?
Well, getting into a little bit of a wonky thing, there is something that was actually required for Florida before it was required for the whole country in these new regulations called the medical loss ratio. And what that is essentially for every dollar you spend, how much is going to patient care. Now, it's something that somebody should be paying close attention to. And so Maggie, I'll suggest it for you going forward. The Miami Herald actually has an article running last night. That reporter is digging into it. That should be, if that's transparent and people can understand it, is kind of a measure that helps us get at this question of how much of the Medicaid dollar is going to patient care, and that's sort of a fundamental issue. Unfortunately, it hasn't been very transparent, and it also, as I understand it, it's getting reported in the aggregate and not plan by plan. So there may be others in the audience who have followed this, but I think this is a way, if we could get that to be more transparent and a better marker, that would help us compare the companies to each other to see who was spending more of their dollar on patient care. What I understand from the Herald reporter is that when he was looking into it, he found a big mistake, that the state had been underpaying the
Right.
plans.
Yeah, so the plans, I mean, they were coming back and asking the state for more money, and it turned out that the state wasn't giving them the money that they needed.
to deliver the care.
Yeah, so I mean,
To the tune
look,
of about
they're
$450 million.
right, they
Yeah.
categorized some people in the wrong category that
Yeah.
were sicker people, and they should have got more money for them. So, I mean, you have a lot of for-profit plans here, and it's interesting that they feel they can make a profit, otherwise they pull out, right? I mean, they are for-profit plans, and your managed care market is characterized by the fact that you have so many for-profit plans. That's relatively unusual. So, obviously, you've had a lot of turmoil in your market too over the years, with plans coming in and out. The state has tried to stabilize that a little, but you know, the fundamental issue is if you're gonna essentially turn your program over to these plans, you're sort of at their mercy, right? I mean, that's another problem. But I don't see the state pulling out of managed care. That is where most states are at. I think that's just not likely to happen.
Okay, thank you. Yes, ma'am.
My name is Linda Stone. I'm with Community Health Centers in Sarasota County, and I would say we're probably the Big Smith provider here in this area. And a couple things I think need to be looked into, one of which has to do with pharmaceuticals. One of our managed care companies sent letters to our people that are in that managed care plan, telling them they could no longer have their prescriptions filled at our centers. And we have 3 sites, all of which have in-house pharmaceuticals, and we have 340B pricing. So we're a federal qualified health center, we get good pricing on our medication, and we were told that our patients would now have to go to CVS. My guess is, just my guess, that there are some kickbacks going on. Care company. Number 2, we are in the process of going from a public entity, federal qualified health center, into a privatized one. Our biggest concern, one of our biggest concerns, is getting our board certified, all of our physicians, adult children are board certified, getting them credentialed so that we will have to get a new Medicaid number, we will have to get them credentialed by the managed care plans. They will take 6 months, they will take 8 months to credential them. Now, that's very interesting because there's a big hue and cry that there are not enough Medicaid providers in the community. So I think this is something that also needs attention.
Okay, I think Dr. Fleener mentioned that, the credentialing process and the access
Oh,
to
absolutely.
so just tell us briefly what you're facing,
Well,
which I cannot remember exactly what you told me.
okay,
but-
what I mentioned to Tom Tryon was that ACA and the Florida legislature actually had a meeting within the past month, which I attended by a phone, where they very happily announced a bump up in reimbursement. And this bump up in reimbursement would be for board certified pediatricians and board certified OB-GYNs, providing care to Medicaid eligible children, as long as they were certified as a medical home, which I don't know if you're familiar with that process, but as I was trying to explain to Tom Tryon, is a process that can take up to 2 and 3 years with the wind pushing you from behind and a lot of help.
We are in the process of finalizing it. We've been working on it for 3 years.
3 years. Okay, so what I said is not true.
Finally, at the end, and we hope by the end of this month, we will become a patient-centered medical home. All of your processes have to change.
Exactly. And I pushed that little button on the phone that allowed me to give some commentary in that meeting, since I'm an obnoxious little mouth. And I said, you threw the baby out with the bathwater. I said, because what happened to all the other providers who are providing care to the Medicaid children? What happened to the family practice docs? What happened to the nurse practitioners? What happened to the internal medicine docs that are providing care to these children, especially in the middle of the state where there are less physicians available and the facilities are not as large as in the larger centers? And you've dissed all those doctors who are your workhorses, who have been seeing your patients for 15 or 20 years, and you've just thrown them out with the bathwater, which is basically what they did. So they're going to give their little increase, and that increase, by the way, is at the mercy of each insurance company designating each particular doctor that they wish to have participate in that little program. Well, I think once again, they should just do get it back to the Medicare level, and everybody can participate or not as they will. But certainly what you're going through sounds so familiar to me.
Could I add something to that really quickly? I just want to add that it's really frustrating to hear these sorts of things as a parent, because it is so difficult to find a specialist anywhere within an hour to an hour and a half vicinity at times. So my assumption was, of course, that that doctors are no longer wanting to deal with Medicaid because of financial issues. So to think that there are doctors who are trying to maintain their relationship with Medicaid, not being able to.
It's incredible.
Unbelievable.
It's absolutely incredible. You know, it's very hard to negotiate with them or to get any help whatsoever. It really is.
Jones, you want to
I
jump
just
in
want to
a
say
little
one thing about this Medicare reimbursement level. Maggie mentioned that was part of the Affordable Care Act, and it was 2 years, 2014, 2015, bring those rates to Medicare levels. The reason it ran out was really a budget issue. I mean, it was when the bill was being negotiated, that was ended up all they had money for. There was an attempt to extend it last year, but it failed in Congress. And there were about 10 states that actually used their own money. They get federal match on it, but they put up their own dollars to maintain those rates, but Florida was not one of them.
Unfortunately. No, it's not all about money, really. It isn't.
Go ahead, Fred.
Hello. I wanted to say that I met Dr. Carolina 30 years ago.
When you're a baby, right?
With my baby. And I'm telling you, she didn't answer that question. You say, why did she continue to do this? Because she is so good at it. And she's got a pipeline there that works an assembly line that's so amazing that you wouldn't believe. Because I've sat in there for an hour or two listening to sick babies for quite a while. So I understand that process. But my also observation I have is, I have a 17-year-old cousin that lives with me now. And he had a wisdom tooth problem a couple months ago, and I went to West Hillsborough County. That was the only place that I could find that would do his dental work. And so I thought this was insane. I said, why am I going way here? But his mother, who was managing the Medicaid, says, that's the only place I could find a dentist. And so that's the problem. So what I wanted to ask, is there any transportation in this Medicaid process that we could, because it took a whole day.
There is some transportation available. You have to book it 24 hours ahead of time. It's not as reliable as you would hope, and you do have to contact the Medicaid office or your insurance company offices to arrange it. But
the plans are supposed to provide it.
Once again, what you've touched on is you were forced to go to a doctor that you didn't know, you didn't trust.
I could even find a place.
Medicine is not practiced that way. Okay, we refer to other physicians and specialists whom we know I know what my expectation is when I send my patient to the cardiologist. I know what my expectation is if I send him for physical therapy. But to send a patient up to Hillsborough County to some dentist, I had one lady who came back to me last month and she said, well, we went to that person on the panel and it was way up in Tampa and he had bars on the windows and he wasn't wearing a uniform and the place stunk and it was filthy. And when she finished,
where I was.
when she finished with the list, I was so horrified. I was so horrified that my patient had gone to this place and who knows what kind of care was given. I mean, this is what's frightening about this, and these are some of the things that have to stop.
So, can you kind of compare and contrast, say, the experience of your Medicaid patients and your private pay patients?
Well, in our practice, they're all treated the same.
Right,
Yeah, we gotta start with that.
but in terms of how the insurers interact with you, do they deny a lot of claims?
Well, sometimes we do get denials, but certainly not as we are from these insurance companies. And I know that Joan does not think that we can backtrack to Medicaid, but I have to say once more, when I used to talk to the Medicaid office down in Fort Myers, I got what I wanted.
Yeah.
If I wanted transportation, or if I wanted something special, an oral surgeon or something, I got it. I'm getting the most ridiculous denials right now I'm getting kids who need an MRI, who the neurologist says he needs an MRI, and we can't get an MRI. So now the poor neurologist is forced to practice neurology in a manner in which he's not comfortable either. This is forcing us physicians at all levels, primary care level, specialist level, to practice in a manner which is not consistent with good care.
So I have one state for you, Connecticut. Connecticut is the only state in the country that has moved from managed care back to a more of a primary care case management, kicked out the insurance companies. And they say actually they're saving money as a result too. So there was a Wall Street Journal article about it a few months ago. We all might want to circulate it, but that's my hope for you, Connecticut.
Okay. And we'll, yes, can we check shirt, sir? Yeah.
So I'm all for bashing insurance companies, but one of the issues that has been thematic in terms of Medicaid managed care is trying to find an accountable organization to hold for these standards for kids' care. And I'm interested to hear your
I'd like to address that because
your interactions with the Agency for Healthcare Administration since some of the changes with Medicaid managed care, how has that impacted?
Well, I've written multiple letters to Justin Senior, who is the head of ACA. Okay, and I think by now he thinks I'm the obnoxious little doctor down in Sarasota. But basically, I've also written a letter to every senator and representative in the state of Florida who has had anything to do with appropriations having to do with medical care or health care. And I've laid it out for them, what is happening, what is the cost to the patient. I've explained all of that. ACA has made it very clear to me that they do not supervise the insurance companies, that their only responsibility, as far as I'm concerned, is to make sure that my insurance company is talking to me and that we're actually conversing and able to negotiate any claim or issue that I have. And they draw the line beyond that. Back in the day, ACA did supervise care. They actually audited my practice back in 2008. Okay, so that was a whole different ACA than the ACA that we have now. Okay, a whole different kind of ACA. And as far as I'm concerned, these insurance companies are like monsters out of control, and no, we don't have any state supervision like we should have. And I'm sorry, but I just don't get the feeling they're being supervised.
Okay, and then behind you? Yes, ma'am.
We've addressed the insurance problem. Isn't this a legislature problem here in Florida?
Yes.
What can we as organizations and people, what can we do?
All right, well.
When we leave here,
sure.
right, what can we do?
I think one of the things is to ask those questions when you confront or talk to legislators. If you give money to legislators, if you happen to, that could be conditional, a conditional give. I know that, we will be attempting to not just shed more light on Medicaid, but ask that question more frequently during the election seasons. I think that's the one thing. And another thing that we haven't touched on, and I'll let Maggie and Joan maybe briefly mention it, Medicaid, there was a settlement in federal court over Medicaid access. It was a class action suit, as I recall. So now the state agreed to a settlement with the plaintiffs, and just from my personal perspective, when you have a federal judge who is appointed for life, unelected, doesn't have to run for office, and if that judge cares about this issue, this judge can ride herd and make sure that that settlement is in effect. And legislators who ignore that do that at their own risk. I mean, so anyway, tell us a little bit about the case and the settlement if you want to, and really briefly, because it's significant.
So I'll say a couple of things about that. So the case Tom was referring to, a group of pediatricians, parents, pediatric dentists brought a class action lawsuit over 10 years ago, essentially alleging that the state was denying care, and laid out, very, very clear instances of not meeting federal law. Medicaid is a federal program. It was, created by Lyndon Johnson. There's very clear rules, and for kids eligible for Medicaid, it's a right, and there are very clear federal protections that they have. And so the basis of the case was that Florida was denying all that. And that case settled in April. And essentially that in the settlement, it was the first time that the state acknowledged that yes, they were switching kids without notifying parents. And yes, they were not meeting quality standards compared to other states. And so they have in the settlement, there are very clear rules. The state will meet with the pediatricians on this date and discuss this issue, and that the quality or the number of kids receiving care, the percentage of kids receiving care must increase by this much every year for the next 5 years. If that doesn't happen, the court has oversight for at least 5 years. It can be extended. And it's interesting, I was just talking with somebody in Texas today. Texas had a Medicaid lawsuit that settled about 8 years ago. And they were in a very similar situation to where we are now. And basically the woman told me, she said, the fact that the court really, they still deliver quarterly reports to the federal court of what's going on in Texas. And that, there is that big threat of the judge pulling them back in, because they went all the way to the U.S. Supreme Court. I mean, they fought tooth and nail, Texas did, before, really buckling down and actually providing care to kids. And when you look at their quality measures, they've improved. Specifically in oral health, they were really bad in dental care, and they've made a lot of changes, and more kids are seeing a dentist now than they ever have. So we are at a moment where there's potential for positive change. So I think keeping an eye on what's happening, is the state meeting those benchmarks, and if they're not, holding the plans accountable, holding the lawmakers accountable. Also, this is kind of a hard thing to do, but I've gone to some legislative hearings on these bills that talk about in the Medicaid system. Nobody goes, and the only people that are there are the insurance companies. And so, if this is something people are concerned about, work together to say, we're here because we want care for the kids, and we want to improve conditions for kids.
Joan, is this a potential game changer?
Well, there's a couple things. I would say the settlement, and this case has been going on forever. I was actually an expert witness in the case many years ago, in the interest of full disclosure, and it was, I think it is good news that the pediatricians, that we will have regular discussions with the states. I have to say the targets are not that ambitious. I was a little bit disappointed when I saw the targets that were agreed to. So it was a very, and there's a lot of complicated legal issues because the Supreme Court has in the interim ruled on a different Medicaid case from Idaho, and I don't even understand that lawyer. But anyway, so there are reasons for the settlement. So it does provide, I think, the opportunity for more public discussion, and there are things in these new rules, these Medicaid managed care rules, like the state's going to have to develop a quality strategy, and it needs public input into that. So I guess, there are some specific things, and those can be hard to access for folks who are not sort of Medicaid experts and living in the world, but there are two things that I think anybody can do. I mean, one is the legislature does decide the Medicaid funding levels and the reimbursement rates. It's just simply that simple. Like Maggie said, the federal government decides for Medicare, but states decide for Medicaid. So if your legislators here, we want you to invest in Medicaid. And then I think the number two thing is quite simple, what I was talking about, educating folks that Medicaid is a kids program. You do not hear that. And your legislature does not talk about it that way, I promise you that. Understanding how important this program is to kids in your state and the percentage of kids, but just how important it is to the future of your state. This is the future workforce of your state. And defining it as a kids program and educating folks about that. And we have a lot of materials that can help there. I think would go a long way to really, it speaks to, I think, what you were talking about, the way people think about the program, the way people see the program, understanding that it can be a beneficial intervention, and that's critically important to Florida's future.
Maggie, can I just?
Go
Yeah,
ahead.
absolutely, sure. I believe at one time we had a conversation and you shared that there actually is a complaint process for parents, and I thought maybe you could share that, because that's sort of a hidden thing that even I, in all my struggles, never uncovered, and that might be useful for those who work in the community as well as the doctors to know to pass that along to their patients.
Yeah, that was something that we have been trying to do, is basically to teach parents and anyone what their rights are within the system. And like I was saying before, on paper, you have the Medicaid beneficiaries have a lot of rights, and parents have a lot of rights to advocate for their children. The state has a complaint process. It's pretty well hidden, and yes, and you kind of worked through it a little bit, certainly to get the hearing that you guys were able to work through it. It's not advertised. It is deeply buried in the state website. It is deeply buried in the plan materials that are sent to families. You'll get this big old packet, and it's on page 23 of the 35, and buried in this section over here. But it's there. And so, I think the other thing is, if you do work with families that and they're struggling, file a complaint. The way that the system does work is, at the state level, they're looking at, how many complaints did we get? And if we didn't get any complaints, then we're doing a great job. Well, if people don't know about the complaint process, then, you're not gonna get any complaints. And so, from a kind of, health advocacy standpoint, if you're working with families, blow up that complaint system. Tell them what's going on. If they see 5,000 complaints come through in 1 month, they're going to pay attention. And I mean, they have the state regulators have meetings on these complaints all the time. Dr. Flinger will tell you it's not perfect, and they don't. Sometimes they're like, okay, we addressed that issue. They kind of push that aside. But I think just if the overall volume of complaints increased, it would be a much harder thing to ignore.
I promised you the last question.
Well, with trepidation of being stoned, I'm with the legislature. But I've got to say, I'm a legislative assistant for Representative Pilon, and none of you have called our office and asked for help.
But I did write them.
I did write.
To Representative Pilon?
Yes, sir.
Or you said appropriations, so.
But I also wrote to him.
Okay, because actually we are really closing in on mental health, Medicare, we do a lot of stuff for parents, but we have to know what your problem is. We can get to the top person, you can't. And if we know, we'll help, and we can do a lot of help, we do. Half of the stuff we get is on kids. We're gonna hold you.
And so the phone number, the phone
Yeah.
number is call.
I'll take that.
Thank you for being here.
I'll take brave of you.
So what's the phone number?
955, write it down.
955
8077.
8077. Thank you for being here. All right, everybody, we're going to end on time. Thank you very much for being here and your concern. Thank you to everybody on our panel. Y'all are great. And go forth and do good. And good night.